Your name and welcome to Senate Judiciary.
Hi, my name is Dr. Eileen Johnson. I live in Barrington. I'm a clinical neuropsychologist. I'm a clinical assistant professor at Brown in the Department of Psychiatry, and I, for many years, was a visiting professor at Providence College. I'm speaking in support of the Compassionate Care Act, Bill 2051. Leanne Holstein, who Ann Walters just spoke about, is my dearest friend, and I am her healthcare proxy. It's my job to see that her wishes are followed as we navigate bulbar onset ALS. Many patients with this disease have feeding tubes and end up on ventilators to help them breathe. This is their right and, of course, their choice, but a feeding tube and artificial ventilation only prolong the inevitable, and they are not compatible with quality of life, so Leanne will not choose these options. This leaves us with the fear of what is coming our way. Dying is hard work. This is the saddest thing that Leanne has said to me. Well, she texted it to me because the friendliest and chattiest person on earth can no longer speak. The work of dying is made harder by Leanne's lack of control over the end of her life because she lives in the state of Rhode Island. I don't want my friend to die. If there was anything in this world that I could do to make that not happen, I would do it. I don't want any of this. I don't want to spend my days thinking about the end of her life, and I don't want to spend my time trying to figure out how to make you all understand how important this issue is. But this is what I've got, and this is what I'm doing. I'm committed to making the end of Leanne's life as easy as possible, but this is really quite difficult. Her only option at this point is to engage in voluntary stopping eating and drinking. This is where patients who are capable of eating or drinking elect not to so that they can hasten death. My guess is that Mike Gates is also in this same position. It's horrifying to me to think that Leanne and Mike would need to resort to this option, depriving themselves of food and drink and suffering so that they have some control over their lives. How can anyone make the case that that's a better option than medical aid in dying? I will close by telling you that I'm a hospice volunteer. Every week, my dog and I sit by the bedside of dying patients, offering them comfort and care. Patients who are dying are clear in their thinking, clearer than the rest of us can even imagine.
Thank you. Any questions?